Welcome to the Role of ADHD Medication in Psychotherapy. I'm Christina Crow. I am a registered psychotherapist and a clinical supervisor with a subspecialty in ADHD in people of all ages, but in particular adults and late diagnosed adults. As someone who provides clinical supervision to practicing therapists as well as training new trainees, one of the things that I really focus on is the competency therapists must have around understanding how to provide psychoeducation for the role of medication, understanding what our scope is, being able to provide appropriate knowledge translation, so taking the data and the evidence and treatment-based guidelines that are out there in the world for us to use and being able to explain it to people in an accessible way, because after all, that's what informed consent is. So this course isn't about how to convince somebody to go on medication. That's absolutely a patient's choice. But a part of informed consent is that people need to know what they're saying yes and no to. And as the clinician who has, generally a lot more time with a patient than a physician might, just because of the way our systems work, it's really an important opportunity to make sure that we are providing accurate, up-to-date, evidence-based, science-based information I'm also going to share my clinical experience. I'm also going to share pearls. There's so many nuances. So this course, the recording you'll watch has been pulled out of DIY ADHD Couples, which is for couple therapists, and presumes people already have a little bit of background information about what ADHD really is, the neuroscience behind it. And this will kind of talk about how our brain functions, what parts of our brain medication affects, but more importantly, how to understand efficacy, side effects, what's the difference between an unmedicated and a medicated brain, and what's the difference between symptoms and personality, how to help your clients track, how to understand when you need to titrate doses, how to help people have these conversations with their physicians, and then finally, we'll get into how to coordinate care, how to communicate with other healthcare professionals so you can wrap around your patients and get them the best care possible, in addition to the services that you're providing from a psychosocial point of view. So I hope you enjoy it. Thank you so much for signing up, and I can't wait to hear what you think.